Dr. Levy.
Okay, thank you for the opportunity to comment on Bill C-45. As a developmental behavioral pediatrician, addiction medicine specialist, and a researcher in the field of adolescent substance use, I'm deeply concerned about the potential impact of the bill on the health of children and adolescents. I've served as the chair of the American Academy of Pediatrics Committee on Substance Use and Prevention, and I've been the director of the Adolescent Substance Use and Addiction Program at Boston Children's Hospital since its inception in 2000. Over the past 18 years, I've evaluated and treated thousands of teens with substance use disorders. I've personally witnessed the toll of addiction on these young lives, as well as on the lives of countless friends, parents, and siblings. Drawing from my experience as both a researcher and a clinician, I would like to offer 3 suggestions regarding Bill C-45. Number 1, prepare the health care workforce by adding addiction medicine, and in particular pediatric addiction medicine, to the list of needed medical specialties in Canada. With the legalization of cannabis, there will inevitably be more youth with cannabis use disorders, resulting in an ever-increasing need for healthcare providers specialized in youth addictions. Addiction medicine is newly recognized by the American Board of Medical Specialties in the U.S., and I'm pleased to report that the first physician to acquire specialized training in pediatric addiction medicine in North America is a Canadian who's currently training at Boston Children's Hospital. However, addiction medicine is currently not on the list of needed specialties, creating barriers for Canadian physicians. Adding it would help enable physicians to develop expertise in the treatment of addictive disorders and also be prepared to lead the field in the future. Number 2, tighten the definition of cannabis for legislative purposes. Bill C-45 defines cannabis as a cannabis plant and anything referred to in Schedule 1, but does not refer to anything referred to in Schedule 2. This definition is too broad. The efforts to legalize marijuana have altered our language such that the word cannabis can now be used to refer to any product that contains cannabinoids, from the original meaning stems and leaves of the cannabis sativa plant to the concentrated oils and cannabis-infused candies. This loophole should be closed because innovations to cannabis-based products are significant public health risks, and adolescents in particular are more likely to seek novelty and try new products. Number 3, increase the minimum age for purchasing cannabis to 21. Age restrictions can be effective at reducing substance use by youth. Brain development continues through the mid-20s. Setting a minimum age of 21 within federal law not only will push the average age of initiation higher, but the uniform standard will also ease enforcement. In support of these recommendations, I offer the following observations from my years of clinical practice and research. Cannabis is an addictive drug that's particularly harmful to developing adolescent brains. Teens that consume cannabis have poorer life outcomes on a number of measures. They have more mental health disorders, including depression, anxiety, and thought disorders, such as schizophrenia. As a group, they complete less school, and they're more likely to be unemployed or underemployed than their peers. As the director of an adolescent substance use disorders program serving youth ages 12 to 24, I regularly work with children and young adults who use cannabis. In fact, more than 90% of my patients have a cannabis use disorder. Almost all of my patients treated for opioid addiction started with cannabis, and most continue to use it very heavily. I've treated a number of teen cannabis users who developed schizophrenia right in front of my eyes. I don't know what would have happened to them had they not used cannabis, but the statistics always make me wonder if their lives may have been different had it not been for a completely preventable risk factor. While frank psychotic disorders are uncommon, psychotic symptoms are under-recognized. In a recent study of healthy teens at our hospital, we found that more than 1 in 4 cannabis users reported having at least one hallucination, and nearly 1 in 3 reported experiencing paranoia related to their use. Overall, more than 40% of these healthy teens had at least one mental health symptom. More teens use cannabis when it's legal. In Colorado, the number of teen cannabis users increased by 20% in the 2 years immediately following legalization, while falling 4% nationally. As a pediatrician and the parent of 2 teenage children, I might add, this finding is not surprising. The retail sale of cannabis normalizes use. When cannabis is portrayed as benign, harmless, or even healthful, more teens try it and more use it heavily. As the director of a pediatric addiction medicine fellowship training program in Boston, my impression is that the healthcare system in Canada, as in the US, is not adequately prepared to provide appropriate treatment for teens who do develop cannabis use disorders. This problem stands to become much worse after legal sales of cannabis begins. Over the course of my career, I have seen an evolution in the presentation of cannabis use among my adolescent patients that has corresponded with shifts in the types and strengths of cannabis-based products available. Plants have been selectively bred to increase their THC content. Edible products and highly concentrated oils, which were not available 20 years ago, and by the way, nothing like the plant material that parents might think of when they hear the word cannabis, are now commonly used by teens. With these changes, I see more teens with mental health symptoms and also more chronic vomiting. When I started practicing years ago, cannabis hyperemesis syndrome was something you could read about in a textbook. Now I see it frequently. These changes are a direct result of the liberalized cannabis policies in the United States. An industry has been enabled to experiment and create better-selling products, which typically are more addictive and usually more harmful. New and improved is a tried and true marketing technique that encourages both experienced and new users to buy more products. But in the case of addictive substances, such as cannabis, it's harmful and teens pay the highest price. New regulatory approaches for addictive substances that restrict this type of development are desperately needed. Bill C-45 would prohibit the sale or marketing of cannabis to adolescents and young adults under the age of 18, but this approach has failed in the past. Marketing restrictions are of limited utility, tested against the potential for substantial profits. While it is illegal for tobacco companies to market cigarettes to youth under age 18, the familiar story of Joe Camel is a good example of how pernicious advertising can be. Raising the age limit and tightly restricting product development are among the best ways to protect children from the industrialization of cannabis. Thank you for your time and attention to these important issues. I'd be happy to provide more information on the impact of marijuana legalization on the adolescents, and the best way to get in touch with me is via email. Thank you.
Thank you very much, Dr. Levy. And now by video.